Hello, 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 everyone. It's Dr. Tamara Beckford, and welcome to the Dr. Tamara Beckford Show. Okay, for those of you who are in academic medicine, you want to succeed, you have no idea how to do so. Today is for you because we have a superstar. Alrighty, this doc is such a superstar. If most of you guys are experiencing the freeze, it's because of all the degrees that this doc has. So we're about to go on and let you know about all this wonderful thing about her. All right. So she's a graduate of Rush Medical College in Chicago. So all my Chicago people, hello, hello, hello. Alrighty. She did her residency in otolaryngology. So for those of you who are like, oh my God, what's that? ENT. She did her residency in ENT, Medical College of Wisconsin. Then she did a fellowship. I told y'all she's filled with degrees in pediatric ENT and advanced sleep training at Johns Hopkins. She was also faculty there from 2005 to 2000. I told you she's filled with degrees. She got an MPH, she's a master's in public health at Johns Hopkins. I'm telling you, woo, she is out there. Yes. Now, in addition to all of this, right? This wonderful doc, she has authored over 220 original research papers. She's authored 20 book chapters. She's also co-edited the book Essential Sleep Medicine. So all of you guys in academics, if you have this book, she's the one that co-authored this book. In addition to all this, you're like, does this doctor have more time? All right, let me tell you. Not only is she an academic doc, she's also a real estate investor. She does coaching and she does mentoring. Who am I talking about? The one and only Dr. Stacey Ishman.
I'm going to have you do all my introductions from now on.
Oh my gosh. Well,
Thank you.
Wow. Okay. Such a great list of all these great accomplishments. But before we got there, we had probably little Stacey, right? So tell us, when did Stacey decide that she wanted to become a doctor? Give us that part.
So I was 4 and
Ah.
it sounds really great. Like I was 4 and I knew I was on the path, but apparently what I realized is that I didn't like work clothes, and I saw my doctor wore scrubs and my dad wore a suit.
Uh-huh.
And I just stuck with it. I just wanted
Love
to wear
it.
casual clothes.
Love
That was
it.
my motivation. But I did continue on realizing I just loved the idea of working with people and helping and serving. And so
Mhm.
I'm glad my 4-year-old aspirations around clothing turned into a good career.
Oh, I love it. It's like, you know what? I want to be comfortable. What profession allows me to wear comfortable wear?
Right, which is why you go into surgery, right? Because we wear scrubs more than other people do. At least before COVID,
Absolutely.
we did. Now everybody wears
Absolutely.
them.
And you know, the world call it scrubs, we call it pajamas because we
Oh
really
yeah,
know what it truly is.
absolutely.
Alrighty, so now you're there and you know you've put in the work so that you can get the honor of wearing your pajamas every day.
Exactly.
And you decide to go to medical school. Now, while you were in medical school, did you automatically know what you wanted to do? Or did you go to med school and you're like, I'm going to keep my mind open and just see where this takes me?
I'm not sure my mind was open, but I had the wrong idea of what I wanted to do. I thought for sure I wanted to be an ER doctor. And then it turned out I tried that rotation. I did not like it. And so
Oh,
I give this advice to medical students all the time. Like, if you figure out where
mhm,
you come home, even if it's a long, hard day and you're still excited about the patients and the work and the
mhm.
topics, it's the area you should really think about. And if you don't know what
Absolutely.
that is, you should ask the people you live with, because they'll be like, oh, you had a super long day in surgery. You were still happy. You had a super long day on ER medicine. You weren't that happy.
Mm, that's a great advice. You know, because there are a lot of people who, while you're deep in the middle of doing it, like you're working, you're on your rotations, you know, a lot of times you're gonna come home and you're wiped out.
Yeah.
So the people who are with you can give you an idea. So you were wiped out, but you were still so like, da, 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 like, oh, I'm
Yep.
so tired, but man, you should have seen this cool case. Or man, I'm
Exactly.
so tired with this patient. So a lot of people who are around your environment gives you a little bit of an idea
Yeah.
when you yourself are like, I don't know what it is. And people are like, yeah, sure. Now, when you came back from that rotation, you just could not stop.
And
So
the coaches, right? Like the first people who see what you need and can reflect it back to you.
absolutely, absolutely. Alrighty. So there and so for you, it was ENT. When did you actually get a glimpse into the ENT world?
So I loved anatomy, did
Mhm.
surgery, as I'm like, I'm thinking about surgery. And then I became a prosector. So me and one other guy were selected as, top surgical people to
Mhm.
prosect for the physical therapy people. And he knew for sure he was going to be an ENT. I never heard of it. I didn't know what otolaryngology was. So he spent the whole summer telling me how this is what I absolutely had to do. And then there was a course where they said,
Mhm.
"Hey, can you help us?" And they were doing a cadaver course. So I got to see it and meet some of the people. And I was hooked from then on. So it was between my first and second years of medical school.
Oh, wow. Oh, that summer. The
Yeah.
summer between the first and second year.
Mhm.
Okay, nice, nice. Alrighty. So for those who are like, what is she talking about? All right, for medical school, we
Yeah.
get this one summer off. Air quotes off.
Which
And
I
it's
spent dissecting cadavers. Yeah.
dissected cadavers. So that's our air quotes. And it's between the first year and the second year. After that, you're really on for the entire year. You're just
Yeah.
literally between second and third, you get time off to study for your boards. So you're literally studying and then you
Yeah.
go into third year. So that's when I'm like, oh, between our first and second year, that's time off. Wonderful. So your friend who's like super interested in ENT brought you along and you're like, oh, I'm dissecting. Oh, yeah, this sounds cool. So
Yeah.
now you're in ENT and you go full force in it. And, you go ahead, you not only graduate, you match, and now you're doing ENT residency. But you also wanted to do the pediatric part. What made you decide that you wanted to expand the breadth and get in and do pediatric ENT in addition to adult ENT?
So first of all, the nice thing about ENT is we're 40% pediatric anyway. So it's the beauty
Yeah,
of being
that's
in a
true.
special where I get to work with everybody. But I just really find that there's a joy in children's hospitals that you don't get anywhere else. And so I
Mhm,
loved working with the kids. I get to be silly. I get to be
mhm,
funny. I think the people who work there appreciate sort of this level of levity that I don't get quite as much in my adult patients'
mhm.
hospitals. And so part of it's the people you get to work with. And part of
Yes.
it was, that it was just also the ability to do a lot of the breadth of ENT because you get to take care of
Mhm.
a lot of different things just with a different population.
Absolutely. And you're right. In the pediatric hospitals, they're a little brighter. They're a
Like
little
the
funnier.
lighting. Yeah.
They come in and they can be, I love what they bring to the environment. It's understanding that a lot of children, they're going to be nervous, they're going to be scared. Children thrive on routine. And guess what a hospital is? That's not their routine.
Yeah.
And so, yeah, they get to bring this levity, as you said, to, put the kids at ease. And then now the kids start to shine. There's nothing more amazing than seeing a child who comes in and they are like and then like 2 hours later, you're looking and they're smiling, they're playing with you, they're
Yeah.
playing with your ID badge, which is one of the things that the kids love to do.
Absolutely.
Yes, I love it. I love
That's
it. All right.
popular.
Yeah, there it is. The ID badge. And yes, especially my like they're now 9 to 18 months. Oh, they're the ID badge people. I
Oh
love
yeah.
it. All right, so you're there now. You are, and then you also did advanced sleep training. So what was that part of that made you wanted to do advanced sleep training?
Yeah,
Especially when
I had
you're
a
doing
great mentor, so he was like, "Hey, there's almost nobody in pediatrics doing sleep." At the time, there was one other person in the country who was board in sleep medicine who was an ENT. So
oh
I
wow.
said, "Okay, this is an area that's interesting." And I learned more and more about it. And I joke around that I became a left thumb doctor. Like I just persistent pediatric sleep apnea was my jam.
Yeah.
And people were like, "Can you build a career on that?" Absolutely. I just did it. So he gave me great advice and I followed his advice. And I was one of the first 4 people in the country who was boarded in sleep and ENT.
Oh wow. It's always good to get to have mentors who are forward. They have this vision because they see where things are going. And a lot of people aren't really there yet. So they're forward thinking, they can see it. And for you to also trust and that person's vision, it worked, right? So
Absolutely.
it's
Yeah.
yeah. So now what that actually leads to is being around the right people in the right environment, and this is something that you do. So you became this academic physician who is helping others. When did you that bug bite you and said, you know what, this is what I'm going to do? Tell me, when did that bug bite?
if we're talking about academic medicine, I'm still working on that. When I started, I said, I'm going to try it. And I think like a lot of people, I just love the teaching part. And so that's the part that motivated me was that I love the interaction. I love being able to learn. I like learning from the people who ask me great questions. And so the beauty of being in those kinds of settings is you never stop learning. There's continuous education, but also the people coming behind me, like I'm mentoring and teaching them, but quite honestly, they're teaching me too. And some of them are mentoring me. You learn things about that. And so I got the bug as a medical student and a resident. I really enjoyed the education. I was a tutor. I was a prosector, those kinds of things I really, really, really loved. In terms of the action, the all the pieces of academic medicine, it wasn't until I started doing it and realized how much I loved the research that I got into it, because I started off, I think a lot of people have imposter syndrome in every setting. And I said, I am somebody who's great at carrying out research. I don't think I have original ideas. Well, clearly 224 papers later, that is not true. But
you
I
know,
didn't know it.
yeah, I think you got it. I think you got
it figured out now.
Yes. So can you remember the first paper, I mean, that you got published, and like what was going on at that time? And like, how did the idea come to you? And do you remember any of that?
Well, like many people, I think my first paper was somebody else's idea. I think most of us start as medical students or residents, and we work with other people who have great ideas, and we say, yes, right? Like you start off and you just say yes, and you give it a shot, and you make up the method section, you don't know what it's talking about. And,
don't give up the secret.
I know, like everyone's like, I'm like, I'm not sure what I'm writing, but I hope you like it.
I keep going.
Yeah, so I felt everything about it, found like I was a fake and I was an imposter because I didn't really know everything about it, but I learned so much. And I can tell you years later, gosh, I have a process now that's so great, and I can help people work their way through a paper, but I just winged it, and you just do the best you can do. And I didn't fail, right? It got published eventually. And so learning and failing and redoing, like that is the premise of what we do in entrepreneurship, but also probably what we need to get better at in medicine, right? We're terrible at failing.
Yes. And that's a great point because we even hearing the word fail in medicine, it stabs that student in the heart, like emotionally, and because even taking the leap to put out the paper, as you said, you put the paper out, it gets rejected, and rejected is really just like, hey, here are some ways that you can improve. But you see how we say it got rejected.
Yeah, exactly.
And versus like getting it got returned for with instructions and ways to improve it.
It got critiqued and now it's better, right? Like
there it is. Yeah. And then you go back at it. And so look at it, like you said, as the critique, you make the necessary changes and you resubmit. But a lot of us, because we're so many type A perfectionist type personality, like we look at it as, I want it to be perfect the first time. As a matter of fact, I might not even hand it in at all.
Oh yeah. So many people with things that are not finished.
Yeah.
And or so that are finished but are not submitted.
Yeah, that's true. That's the next step, that fear of hitting that submit button, because now it's gone off. So you have been able to help, and we'll talk about some of the things that you're doing. You coach and mentor people within the academic space. What are some of the top 3 to 5 things that you see that might hold some people back? And if they learn this, it will help to propel them and to be more successful in that space.
Absolutely. So my favorite piece of advice, and that I walk people through, is finding your niche. Also, it took me a long time to say niche, but anyway, what you want to do is you want to make sure that everything you put out for a few years has one topic in it. So it's so clear to the world. I want her on this panel. I want her when I'm working on a paper. I want to collaborate on our research. You understand what my area of interest is, and you understand when you should invite me to do academic things that we all think, when can I be on that big stage? When can I be a speaker on the panel? Yeah. So that one I think is critically important, and picking one word that represents it. So for me, at the beginning of my career, I wrote things on medical education and sleep apnea and reflux, and like you had no idea what I was about. Somebody said, just put the word sleep in everything. Well, I said everything. I picked sleep.
Yeah.
And then everything I put out had the word sleep. And then so quickly, I was known as being one of the few people who was
Mm-hmm.
doing pediatric ENT sleep. And my career honestly skyrocketed after those first couple of years because people understood when to ask me to do something or to collaborate. And
Mm-hmm.
it's simple. It could be a word, it could be a phrase, and it doesn't have to be a condition, right? It could be I do meta analyses or I
Mm-hmm.
do curriculum development or whatever it is that you are really passionate about. I do QI projects on patient safety. Like you can pick your thing, but
Right.
pick one thing so that for the first 2 or 3 years, everybody knows it. So that's my first one or two. It's really pick a niche and pick a word and be
And pick
consistent.
a word. I love that. I love that idea about picking a word because you automatically draw focus to what it is that you're doing. And you probably are doing all of that anyway.
Yep.
So when you do put that word, and I love that idea when your advisor, your mentor said, put that word in with what you're already doing. Because as
Yep.
I hear you saying, like, I talk about sleep, I talk about reflux. And guess what happens? Most of the time people are getting reflux while they're sleeping. So yes, you could add
Yep.
sleep to, it's just like phew,
I mean, I
wow.
coach people who do this too. And one of them,
Mhm.
I look at their PubMed and I say, like, can I tell your story from
Mhm.
looking at your papers? And she was doing environmental sustainability work, amazing work. But sometimes those words weren't in the title. So
Mm.
it was the work. It
Yeah.
just was titled as something else. And so it wasn't nearly as clear. And so in the last year or two, every single thing she's done has had the word sustainability or environment in it. And she's taken off. Like people are asking to give talks and they're putting on panels and they're collaborating.
Yes. That is great. And you're right. We're usually told, like, the niche down and focus. But
Mhm.
most of there are a lot of people who have passions and they feel like I'm multi-passionate, and which is true. You
Yeah.
are multi-passionate and multi-talented, but there's usually one thing that's an overarching portion of all of that. So yes, you are multi-passionate, but what's that one word that throughout all of these additional passion that keeps happening, and then
Yep.
just add that in front of that passionate thing that you're doing.
Yeah, I tell people my superpower is to be able to take your word and put it with anything else. If you're like, but I want to do it on allergy, I'm like, great, look at the overlap with snoring and allergy. Like somebody
Yes,
talked to me about hearing, and I was like, oh, what's language acquisition for kids with cochlear implants, and what impact does sleep have on it? Like we can find a way to like
yes,
almost overlap anything. So if you're multi-passionate, just put them together.
absolutely love it. Ooh, so far, all right, cool. What's another great advice? Like people are jumping on, you're like, ooh, I want to hear this. Absolutely.
So I'm going to say set up your clinical life so it
Mhm,
fits your goals. And that's
mhm,
not just about your promotion or academic goals, but your life. I spend so much time with people helping them redo the schedule that they started off with because they're not seeing the patients they want to see, or they're not getting home, or they're doing their notes at home and they're frustrated and they're not happy at home or at work. And
mhm.
so I don't think it matters whether you're in academic medicine or not. You
Yeah.
really need to make sure that those boundaries are set
Mhm.
and you don't fill up your admin time with extra clinical work, or you're not doing your notes when you're supposed to be at a soccer game.
Mm. How easy is that? Like when you first see that client and they're just like, listen, Dr. Ishman, I just don't have any time. You don't understand. I don't have any time. Look at my schedule. What is it that you can automatically see when, because they're so inundated that their mind is cluttered, that their mind can't
Yeah.
see where they can really shift. So what is it that you're seeing?
Yeah. I mean, I think we all know what limiting beliefs are. These
Yes,
are your limiting beliefs, right? We all have them. I tell myself sometimes I don't have time. And then I'm like, no, it's where am I putting my time or my
absolutely.
energy? And some
Absolutely.
of it's what are you like? Actually, everybody I work with, I start with what's your ideal dream? What's your ideal life? What's your ideal career look like?
Mm-hmm.
Because that's how you figure out where your time should go, right? I hear
Mm-hmm.
people talk about time audits. Like, let's look at my calendar. The most important thing is I get a grant out, and all the time on my calendar is not about the grant. Most important thing, right? So
Yeah.
if the most important thing is I make it to every kid's soccer game, those better be on my calendar, and I should be working around them.
Mm.
So I think a lot of that is recognizing what's your dream. If your dream is to just make as much money as you can, then you should just crank it out and do as much as you can. And there's nothing wrong with that goal, by the way. We all feel like
Mhm.
money is a bad thing.
Yeah.
It is
It's
perfectly
just a
fine to make
currency.
money. Use it for whatever you want to use it for. Hopefully it's got
Yeah,
an end purpose. It's not just for the money.
absolutely.
But if that's your goal, then you're gonna be like, I'm gonna crank, and that's what my schedule's gonna look like. But if that's not your goal and you have other things that you want to fit in there, then you
Mm-hmm.
need to make sure that that's reflected. And
Absolutely.
that's really where I start with a lot of people is who do you want to be?
Mm-hmm.
And then how do we make sure your schedule gets you there? And if you're gonna make, $10,000 less because you didn't see the extra patient, but you're gonna get to every soccer game, where's your priority?
Absolutely. You know, I think John Maxwell says that too, right? He says, "Show me your schedule or your plan, and I can see where your priority is." And
Absolutely.
yeah, so a lot of us, we get very caught up in our day-to-day life, and sometimes it can seep in. We say one thing, but our schedule says something else.
Hmm.
And this is for anyone who's listening. This is a reminder to just do a little audit and really look at your schedule and see, does your schedule correlate with what you consider to be the priority in your life? You know, your family time, your career goals, like whatever the goals that you have, and just see if it does correlate. And then, when you're making your schedule, the most important things need to go on it first, right?
Yes. Yes.
So let's talk to that. Yeah.
Well, I would tell you, my wife laughs at me because I schedule family time and dinner and driving to work on my calendar. But if you don't put it in there, it's like you just don't have the time. You don't have the time, right? So
Mm-hmm.
I
Mm-hmm.
do think it's really important. And sometimes I have between my wife and I we have 5 teenage boys,
Mm-hmm.
and you cannot really schedule time. Like I don't know when they're going to be
Okay, how
wanting
do
to
you
talk to me for
manage five
15 minutes,
teenage
or they're just
boys?
going to be yelling at their computers. And so I have to be adjacent for some of that so that I get the opportunity to be there when they're like, "Hey, I have 20 minutes and I want to talk to you about something." And so I do think there's some importance to some of that flex time too, but I think you
Yes.
have to write it in your calendar. And I also think you have to stick by it so that you're
Mhm,
also showing your kids and your family and your spouse or your friends that you
mhm.
value them. And if you're like, oh, I'm going to be there at 5, you're not there till 6, they understand what that message is. My oldest son tells people my job is I leave my children to take care of other people's children. That's what he told me before COVID. And it
Mm.
wasn't wrong. And so I actually changed the way I prioritize myself significantly. And the other day he told somebody I used to be a doctor, which I'm going to take as a huge credit because he
Yeah,
doesn't think I leave them anymore to do
yes,
things for other people.
yes. There's another doc that I spoke with just so casually. She's a pediatrician, and she said her daughter told her, she was like, "Oh, well, maybe I should just get sick so you can come and spend time with me." I
Oh,
know. I remember like, oh, like that is so piercing, but it that's how kids feel.
yeah,
And we look at that as a sign, and that they would like a little bit more attention, and then you rearrange, like, in order to do that. I mean, my son's the same. Well, can I come to work with I know what can I come to work with you means. Like,
yeah,
okay, we're not spending enough time here, and I
yeah.
want to spend more time with you. So
Yeah,
now,
and we have to learn to listen, right? Because
yes.
it's so good that you can translate that.
Yes, absolutely, absolutely. All righty, so cool. So we've learned that lesson. All of us have learned that the hard way.
We're hoping people do it better than we did.
Better than we did. Absolutely. All righty. Do you have two more?
2 more tips. Yeah.
Okay, perfect. Good.
So one is to create a research plan with a vision from the beginning so that as all these interesting, thoughts and concepts come in, you only say yes to the things that actually meet your long-term goals. And there's going to be
Mhm.
lots of opportunities and
Yeah.
lots of requests. I can tell you I was an editor for a journal or associate editor. And I
Mhm.
thought this was going to get me promoted. I thought it was going to be great. It was in the sleep area. And sure, it was probably good for my promotion, but I hated it. The best
Mhm.
day ever was the day I got rid of that job. And so, at the very least, a good thing I did was find something that fit. Like if somebody put me on an ear journal, I should say no.
Mhm.
But also, you have to like continue to reassess that stuff. Does it
Yeah.
stay on your plan? Does it still serve your end goal? And so, by
Mhm.
starting off with sort of my mission and vision, which included enjoying what I did and only working with people I liked,
Mm.
I was no longer serving it the way I was supposed to. And so that I had to shift.
I love that. Did you? Like, I'm saying it to you as if you didn't just say this. But did anyone else out there in listenership land hear what she just added onto her mission and vision? It wasn't just even though the thought process is where I'm headed, and just so that I can stay focused, but it also encompassed the portion of how it meant to me. am I working with people that I like to work with, and am I enjoying what I'm doing? Because sometimes we make decisions, and sometimes we make the decisions for the wrong reason.
Yeah.
And we feel as if in the long run it'll work out, but you're around, like, each day you're just dying slowly more and more on the inside.
Yeah.
So is it truly worth it? So are you around the people that you want to be around? Are you, happy? Are you going towards the goal that you have set for yourself, which is not just the career goal, but also your life goal? Because if you're coming home unhappy, guess who has to deal with it?
Yeah.
Yeah, the
They'll
people
let
who
you
love
know.
you,
Don't worry. They'll tell you.
right? Then you'll hear stuff like, well, maybe I should just get sick so you can
Yeah.
take care of me.
Or
But
please
it's so
don't come
important.
home. You're unpleasant. You're like, oh,
Yeah, you are unpleasant. Yes, you're always so mean. Why are you the mean one? Why?
somebody, I won't have to say who, but told me, you're not the doctor here. Like, you're not in charge. I was like, oh, okay,
Oh,
sorry.
okay. Well, but it really just goes, when you're trying to build, like, even I'm a part of entrepreneur. The thing about it is building your dream life in addition to your business. So it's building the academic life that you want, but your dream life goes along with it. So you cannot just push forth on just one aspect and then ignore the other. Because in the end, if and when you do get to that point that you feel like, yes, I've achieved X and I can check this off, like, who are you enjoying that time with?
Well, and I'm going to tell you, even on the academic side,
Yeah.
it is so much more likely at the end of a long day that if I like working with you, I'm going to call Dr. Beckford and we're going to talk about that paper working on. And
Yeah.
if I'm not really enjoying working with you and it's 6 o'clock on a Friday, I'm not calling you. I'm not working on the paper. And so,
Why would you want to burden yourself with somebody you want to connect with, right?
but even on an academic side, it really makes you more productive to work
Yeah.
with people you like and do things you enjoy.
Yeah. And you move further because the creativity comes in and you're like, okay, cool, have great ideas, boom, and you just execute it.
And who
So
doesn't like listening to someone who loves what they're doing, tell you what they're working on and give you the presentation and present the
mhm.
paper? Like, I love hearing those people. They're like excited. I get
Yeah.
excited about stuff I don't even care about.
I love it. Their excitement rubs off.
Yeah.
All right, cool. So let's give them the final tip because it's really about that balance and, being around people you like, getting the things done, making sure that your family is up, and all the things that are priorities are on your list. And, recognizing that you can go farther when you are around the people that you like and you like to work with them.
Absolutely.
I
And then my
love it.
last tip is very academic, but
Mhm.
it's develop a promotion roadmap, meaning know
Yes.
the promotion criteria from the very first day. Walk in the
Mhm.
door, see what's required, see which track you're looking at. Are you trying to be
Mhm.
an educator? Are you trying to be a clinician? Are you
Mhm.
trying to be a researcher? And then you can plan your career around it. So if I need to write 3 papers a year, I want to know that up front instead of 3 years down the road when I've written three total and now I'm six
Right.
behind. Or alternatively, if I need to get great reviews from students because I teach in a course, then I want to start off figuring out what course makes the most sense for me to teach in from the
Mhm.
very beginning. And so it really helps you put that together. And there are actually some really easy AI prompts to put together your CV with the promotion and create some good, easy roadmaps. So I include them in my course, but if people even just want to play with it, there's some easy ways to use AI to kind of set you on the road and figure out yearly goals so you can break it down.
Having a plan, so important. And you're right. I love that it's one of those things where as soon as you step your foot in that door, you start to organize yourself. And there are many people I've come across people who have unfortunately weren't really aware of their criteria until like you said, a couple years down the line, and they're doing great work. But
Mhm.
it's one thing to toil, and then there's another thing to be able to do the work that will get you to where you want to get to. So it's working smarter, not just working harder, because you're
Absolutely.
going to work hard no matter what. So why not be able to reap the benefits from what you're doing? And
Yeah, I
not
don't know
only
many lazy doctors, let's be
that's what I was
honest.
about to say. That's why I
When
said
we
you're
call
working
them
hard.
lazy, it's ridiculous because they've just made it through medical school and residency. There's no lazy doctors.
No, no. being aware of the criteria when you're in academic to get you to that goal that you've set is so important. Now, you've mentioned like in addition to all this, you do real estate investing. All right, we're going to take a few seconds and I'm just going to try to figure out how. Where did, where did you find that time that I keep asking people about?
That's interesting. I did it for time. So what I realized one day is I just didn't want to always have to trade my time for money, whether it
Mhm.
was something I loved doing or not, So I took a course and I bought 12 units and now I'm working with a group of other physicians and we're having people syndicate and we're providing the opportunities for investment that I wish somebody had provided to me 10 or 15 years ago. And so the goal really was one, I love learning. It's new, it's interesting, it's fun. I like the people I'm working with. It fits that whole joy and
Right?
factor. And then honestly, I feel like it's really going to open up my opportunities in 5 to 10 years. And so
Mhm.
I love what it can do for me and my family, and I love what it can do for my friends and family and other people who might have an interest in also buying back their time.
Absolutely, absolutely. Real estate is, and we all know, I remember I have an aunt, she's in Canada.
Mm.
And when I was younger, she would live in different parts of the world. And everywhere she went, she bought land.
Oh,
So she
wow.
has, yeah, so she has like properties all over the world. And she always told me, she said, Tamara, she's like, land is not anything that can go rotten. It doesn't rot. It'll always just, become more and more and more valuable. So keep that in mind. And that is a great advice. And I love that you're tapping into that because if you really do, and this has nothing to do with medicine, this part is life. If you look at those who are able to in in the long run to be able to live and not, like you said, trade time for money, their portfolio has real estate in it.
Absolutely. It's a diversification, right? Like we're all used to being in our 401k and in the stock fund or an index or crypto, whatever you're doing. But
Then yeah.
it's a pretty stable whether the market goes up or goes down. And there's been times, right, where it stayed flat. There's
Mm-hmm.
been, if you look over time, it's actually done at least as well, if not better than the stock market.
Mm-hmm.
And in the end, it's a building sitting there. You know what I mean? I don't know what the pieces of paper are that my stock is. And
Mm-hmm.
I have some, just like everybody else. But I can look at the building and I can figure out how to do that. And the other thing too, like one of my buildings I have for Section 8 and rapid rehousing for domestic violence victims. And so I can
Mm-hmm.
feel amazing about the mission. I got all
Right.
my neighbors to donate and we made the Christmas for 8 families who really couldn't
Oh,
afford anything. They got to
nice.
pick whatever they wanted. And it was the most adorable thing you've ever seen in your life. There's like 40-year-old men picking up things for their kids who were more excited than the kids who were like getting a puzzle. They were like, oh my gosh, this is amazing. So,
Yes.
like, that part too, you get to do a little bit of that, like
Mhm.
provide your mission at the same time, which is, I love.
Just yeah, give me chills because it's merging two parts. It's merging. Yes, you are investing for financial gain, but you're also providing for others. And that's part of our basic needs, right?
Yeah.
Shelter, other than food, shelter is a basic need, and to be able to do that and then do mission work with that, it really does encompass the whole part of it brings a wholeness to what you're doing, that it's not just that yes I'm helping, and it also goes along with being a doctor. I'm just going to say it, us doctors, we just love
Yeah.
to help every little way that we can find to help. We're like, oh, let me help, which is why boundaries are so important because we love to help. We love
And
to
don't be
definitely help.
perfect. I was trying to wrap everything and finally I'm like, okay, I have to give up. I can't put I can't wrap all these things. And nobody cared. They were perfectly happy. We're giving them Christmas presents.
Absolutely, absolutely. All right, that brings me around to burnout. So, because when we're talking about boundaries, because we love, love, love to help. Have you ever experienced burnout? And if so, what did it look like for you?
I definitely did. Right before COVID, well, a couple years before COVID, I was in the midst of a divorce,
Mm-hmm.
which if anybody's gone through one is a lot of emotional turmoil, regardless of whatever the terms of it are.
Right.
And at the same time, I think I didn't have the energy to present myself the way I wanted to. I wasn't as understandable to other folks. I
Mm-hmm.
wasn't planning. I wasn't leaning into any of the joy. And so everything started feeling like drudgery. And
Mm.
so much of those conversations and the things that got me out of them, I did get a coach actually, and I did get a therapist,
Yeah.
both of which were critically important for me. And then relying on talking to people and
Mhm.
leaning on your friends and finding my why. I had to get back to why am I doing this? What do I
Yeah.
like about it? What do I not like about it? It
Mhm.
was the beginning, honestly, of my thinking about pulling back my time. And I actually left clinical medicine for 18 months and then I went back
Mhm.
because the time away was great to really figure out where I was focused.
Mhm.
I never actually stopped doing the work on the grants. I still had research, I still had papers going. So I still loved so many parts of the academic mission, but
Mhm.
I needed to reassess whether it was right. And that's pretty dramatic. Most people don't leave academic medicine. I was in administration at the time, so I wasn't,
Mhm.
totally out of it. But it was a really good opportunity for me to figure it out and go back, honestly.
Mhm. Now, would you say during that time that you stepped away, did you, when you went back, did you feel like was it a rebirth of the newer version of you who understood and accepted and thanked the older version for helping you to get that far, but now this newer version is stepping in with all the experience. Yes, there's hurt, there's pain, but I've found some of the joy, and now I can get rid of the things that weren't bringing me the joy and focus on more of what brought me the joy to push me forward.
Absolutely. I would tell you that some of the best lessons I learned were some of the hardest when I was
Mm,
walking away. Things recognizing things I hadn't done well, people I hadn't treated the way I wanted to treat.
mhm,
I had a junior colleague who really felt like I wasn't including her, I wasn't listening to her. And it turned out I was so busy getting the work done, making sure
mm,
that that project got completed, that I was kind of running over her. Her name was on it. She still got, in my mind, she still got credit, but in her mind, she was trying to build something. She was
mm,
working on her own career, and I
mhm.
wasn't listening. And so it is one of the lessons that's been most useful for me is that just because I think that this is, the criteria or the timeline, and I'm collaborating with somebody, I absolutely need to be understanding what their goals are because they weren't the same as mine. It wasn't to get the paper out.
Yeah.
It was to, do the work that she thought was authentic and take care of the patients she thought and do a better job clinically and all things that I agreed with but didn't recognize. I think we valued in different timelines. And so
Mhm.
it was one of the best things I ever learned and one of the hardest.
Yeah.
And I haven't, honestly, I haven't gone back and thanked her. And I really need to because
Mhm.
it has changed me as a leader. I'm the chief medical officer on the side for an insurance company. And so, those things have changed the way I lead and even look at my own life. And I went back and I work at a children's hospital again, part-time, and absolutely love the opportunity now
Mhm.
to get to be in that kind of joyful space and work with the kids and be silly and those things.
Ah, love it. And you're right. Some of the best lessons are the most painful to go through. And especially when you are honest with yourself and realize that in order to get through that, you had to reflect. And part of the reflection was like, wow, I hurt someone on my way here.
Yeah.
And when you're not the first doc on the show that we've come to this conclusion with. And, but it also, like, for those who might have felt like you were listening to this and felt like, wow, and yes, she didn't listen and she didn't understand. I think it's so important for them to realize the impact that that had on you and how it's made you a better person for all these now newer people who are coming and they're experiencing your world and being part of your orbit. Like you said, you did the reflection, and I mean that reflection, no matter how we look at it, it hurts. I've
Yeah.
done reflection, I'm like, oh, that makes me nauseous. You can
Yeah.
send me some Zofran. But you also realize how that time frame where I can now be better, and I'm easier to recognize when I'm going down that path, when I'm about to make that same mistake, when I'm getting into that mode. Because a lot of it is really because you get so zoned in. And when we're zoned in, like sometimes, like we said, we're type A people. We kind of like become like a laser beam. But in taking the time when we find ourselves getting there and asking and connecting with those around us and having them pour into us as we pour into them, it really helps. and it has elevated us not only as leaders but also as human beings and as people to be around, people with whom we love to connect with, and people with whom others love to connect with. So, hard lesson, but we appreciate it, and we thank those on the other side who has helped us to learn these lessons. So it wasn't in vain.
Oh,
So
no, it was probably one of the best lessons I ever learned.
yes, absolutely. Alrighty, so we've gone through all that, but I got a fun question for you.
Okay.
Alrighty, so if you weren't a doctor, I got to shimmy into the question.
Okay.
If you weren't a doctor, all right, let me start taking some things off. So nothing ENT, you're not writing. No, I'm not even going to allow you to write. That's how bad. All right, so you're not writing, you're not designing scrubs either. Okay. So, or pajamas.
No.
And let me see, what else did we talk about? Okay. All right. Those are the only things I'll allow.
Off the table. Okay.
All right. Go ahead. What would you be?
It's interesting. So I love water. So
Mhm.
ship captain would be great, like, like a schooner or something. I also love whiskey. So I was trying to figure out if I was going to be like a whiskey maker or something like that.
You don't
I
have
would
any
love to
whiskey
be someone who
makers.
creates bourbon. I don't know what the sommelier equivalent is for bourbon or whiskey, but that sounds like a great job to me. So what I think I have to do now, get a house by a lake, do some kind of whiskey experience on my boat.
Absolutely.
I'm not going to
Absolutely.
be drinking while driving, just to be clear, but
Nor,
everybody else.
nor, nor while on our
Right,
boat.
exactly. Or I need a captain. Maybe I need a captain.
So we'll get a captain, we'll get the lake and the premier whiskey or
Experience
bourbon.
the
Yes.
schooner.
And
Mhm.
then so because we do have some people, we have decorators, so we have florists, we have interior designers, so the lake house is going to be like
Oh,
really,
yeah.
really great. And
Uh-huh.
then we do have some people who they have small bakeries, so whiskey infused cakes was, we have,
Love it.
oh, I love it. All
Yeah.
righty. And we do have some gardeners, so we could do farm to market, type of beautiful, beautiful food. And then we do have some dancers. I don't know if anyone is singing yet. So we would have to still get the entertainment. I'll do the dancing, but I told you way back.
I can
But we
sing,
don't.
if we need somebody and like I could probably pull it off.
Okay, all right, yeah, we'll get the entertainment. So this is my utopia, and I just built another one. Almost every episode we have a utopia. So this one I love is by the lake. So if anyone wants to join us in our utopia, you're welcome to join our imagination. All righty, so Dr. Ishman, this has been really great, but I know that there's some people here who are listening and they've been watching, and they are definitely in need of your service. So let them know, how can they find you? What do you have available to help those in academics, those who really want to get that career going? Especially, we are at the beginning of this year, so there are a lot of people who are going to be graduating from fellowships. They're going into academics, and they want to be able to excel at this. So tell them, how can they connect with you and what you have available for them.
I do some one-on-one coaching, so that
Okay.
is available, and my website is medicalmentorcoaching.com. I also have a group coaching program for early career physicians that starts in February.
Oh,
And
nice.
actually this month I just launched my academic physician career Kickstarter course. So it is 4 modules that you can learn how to create your ideal career. You can come up with your ideal practice. You
Mm-hmm.
can set up your research plan and set up your promotion roadmap. And so it is actually, we're just kicking it off. My founders just started this month, but we'll be launching again actually in that July, August timeframe for exactly that group you're talking about, people new to their practice, so that you can start off and not waste any of your time and make sure you set up your schedule the right way.
Ah, love it. Now we have one of our docs. This is a lovely alum of the show. And, Dr. Rachel Corridon, she's like, academic careers seem difficult. I'm pretty sure that you hear this a lot. So she's an OBGYN. She's also in Trinidad and Tobago. And so for those who are also still thinking, and they're like, oh my gosh, this seems difficult, let's put them at ease. They're already doing hard work no matter what.
I was going to say, I don't know any doctor who's like, oh, my job's easy, but I think it's just different, right? Because most of the people in academic medicine are not doing all the nuts and bolts of running the practice.
Yes.
So I think it depends, again, what's your ideal career? Do you like teaching? Do you
Mhm.
enjoy discovery and scholarship? Like, are those things that do you want to be able to do those? Because there's a lot of business on whether you're in academic medicine or not. We all got to make money, we got to cover our expenses. But are
Absolutely.
you worrying about hiring the MA and balancing the budget and figuring out which 401k program you need to do for what benefits are this year? That's what you have to do in private practice, right?
Mhm.
And the sort of the in between is those hospital based people. But I'm going to tell you, I don't think any of us have it early. It's just lean into the thing that you like. So if you're like, I don't really like teaching or, papers, there's plenty of people in academics who don't love writing papers, but they love teaching and they
Mhm.
can collaborate with people to get a few papers out in a year, enough to move along and enjoy it. And they like
Mhm.
having residents on call. Let's be honest, that part's nice. But it just depends on what you want to do with your life and what gives you joy. Because like if you have to be the editor of a journal, I'd be like, no, thank you. I'll never do it. But if you're like, I love teaching and that feeds me,
Mhm.
that part absolutely makes sense. I mean, I tell people every physician's already a coach, right? We've all coached medical students, we've all coached our peers. We are all people who know how to do this. So you're already a teacher. You just have to
Mhm.
decide if you like it or not.
Yes, absolutely. And it really is just going, like you said, after your passion, things that you do like, and being honest with yourself, right? A
Yeah.
lot of us, we've put in so much work. So if you honestly are like, listen, I like to just work independently. I really don't like to talk to anyone or go over or get questions by a student or resident, then maybe that's not for you. If you're like, I thrive in showing how to do this and I thrive in learning from the questions and exploring more and learning all the newer things, and then yeah, it sounds like academic is for
Yeah.
you.
And if you have burning questions you want to answer that aren't answered, that's what academics does, right? Like I wanted to know the best way to take care of kids with persistent sleep apnea. And the
Mhm.
best way to do that is to actually just keep studying and iterating and looking at outcomes and collaborating. And so that for me was a driving passion that if something else was annoying, I could keep working through.
Yeah, like we said at the beginning, when you came home at the end of the day,
That's it.
what did you couldn't stop talking about, you couldn't stop thinking about, and that's what this is, and that brings you to that part. So thank you so much, Dr. Corridon, for joining us and for giving us that quick insight, because you're writing what a lot of people are thinking, so that definitely is helpful. Alrighty. So for those of you out there, Dr. Ishman is available for those who need coaching. You want to do academics. Tell them again the website so that they can be able to connect with you. First iteration is going on now. We have a lovely program starting in February. Those who are finishing fellowship in July, don't forget, Dr. Ishman is here to help you. Go ahead, let them know how they can connect
Yeah,
again.
it's medicalmentorcoaching.com.
Yes, medicalmentorcoaching.com. How do you remember? Remember, you're doing medicine and you're looking for that mentor and you're getting that coaching.com.
Exactly.
Medical
Or
mentor.
just Google Stacey Ishman coaching.
There we go. Love it, love it, love it. Alrighty. Any last words before we finish this wonderful conversation today, Dr. Ishman? I had so much fun.
No, I really think it's so great what you're doing, having these conversations. And
Mhm.
I watched a few of them and really enjoyed people talking about building their dream careers. And I really think that that's what we're talking about all the time, is just how do you build your dream life? And
Mhm.
I think honestly, having a coach helps regardless of what you want to do. I really
Absolutely.
focus on academics. I have coaches who are talking to me about lots of other things.
Mhm.
And so I want to encourage people, don't think of coaching as remediation. Like my
Oh,
first coach
no.
was because I wasn't doing as good a job with the residents as I could have. I wasn't looking up, I wasn't making eye contact, but God, it was the best thing that ever happened. And so I think we need
Mhm.
to reframe. Like every athlete knows if you want to go from good to great, you need a coach. And we're
Absolutely.
already all amazing. So if you just want to level up, coaching does it.
There we go. Love it, love it. You want to level up, the coaching does it. And you're going from good to great. So you're already in that category. So if others in other the sports and other executive categories, they've figured this out, then I think for us in medicine, we can do
Even
it.
your chair. Like I was in a room with all the ENT chairs, and half of them raised their hand that they had a coach. So we figured it
Yeah.
out.
Let's trickle that down. Let's trickle that down. Well, with that, I know here, this is what usually ends up happening. So people are jumping in near the end of this conversation. They're like, I'm just hearing the end of this. And I said, you know what? Have no fear, because this wonderful conversation is available on our website, our yourcaringdocs.com, select podcast, and you'll be able to see this wonderful show. You'll see Dr. Ishmael's beautiful face. Just click on it, and then you'll be able to get that download of this wonderful conversation. Pass this along to anyone that you know who is in academics, thinking about academic medicine. They're unsure if doing academic medicine, will they get any support? They know definitely there's someone here who can support them. Medicalmentorcoaching.com is a place that they can go ahead and they can find ways and different modalities that Dr. Ishman has available to help them. Now, today's episode is available, and it's also sponsored by my other business, which is Truly Balanced Wellness Care. So for those of you who are out there and you are looking for support in getting rid of unwanted weight, so just go to trulybalanced.com, and I'll be happy to connect with you and see if I'm the one to help to support you on that journey, right? So that's Truly Balanced Wellness Care, and I look forward to seeing you, Dr. Ishman. This has been so much fun. I had a wonderful time. Thank you so much for pouring in to our community. Thank you for all that you're doing. Thank you for sharing all the insights, the joy and the pain, and how we learn from it and how we move on and how we use that to better ourselves. With that, we're going to end today's conversation. I hope to see you guys on our next episode of I'm going to say inside our next episode of the Dr. Tamara Beckford Show. I will see you guys next time. Thank you so much. Have a great day.
Thank you.